Good evening, ladies and gentlemen. Thank you so much for coming. My name is Roba. I'm a practicing physician in Houston, Texas. I'm originally from Ethiopia, and I'm the co-founder of the International Fund for Africa. International Fund for Africa is a tax-exempt non-profit corporation dedicated to preventing, alleviating, and abolishing suffering of both human and non-human animals. In October of 2009, I was invited to speak at the second West African Vegetarian Congress held in Accra, Ghana. The first one was held in Nigeria, and it's a yearly event hosted by the West African chapter of the International Vegetarian Union, a worldwide movement to promote veganism. It was first started in Dresden, Germany in 1908. The inspiration for this event came to me on the third day of my visit in Accra while sitting in my hotel room. I had just come back from visiting the Elmina Castle on the coast of Ghana, where slaves from all over the interiors of West Africa were brought to be shipped to the Americas some 400 years ago. 7 million of them, out of which 60% never made it. When I thought of the people I met from all over West Africa who were attending this August event, men and women, old and young, who were there trying to spread the word of veganism, of the word of nonviolence, peace, and reverence for all life, including our animal brethren, coupled with a deep and very disturbing experience I had at Elmina Castle, I felt compelled to share my experience with people here in the United States. Until a year ago, I had no idea there were dedicated, committed, hardworking people in Africa who recognize the immense benefits of veganism on health and the environment, and its deep principles rooted in nonviolence and reverence for life as espoused by the great leaders like Mahatma Gandhi and my personal favorite, my hero, Martin Luther King. Our organization is based out of Houston, Texas. We presently focus mostly on Ethiopia, with some involvement in a few other African countries. In Ethiopia, one of our projects involves saving lives of newborns and premature born babies. Ethiopia, like most of the rest of sub-Saharan Africa, has one of the highest rates of infant mortality in the world. Lack of doctors and other trained personnel, lack of basic equipment, poor infrastructure, and poverty are some of the reasons for the high mortality. This baby, you see breathing so heavily, which I don't know about the sound, after he was born of a very treatable condition. He died because the hospital did not have the machine that would give his lungs time to recover from the insult he had suffered when he aspirated his mother's fluid coming out of her birth canal. And this is one example out of a million. I was there when this baby died, and it will haunt me for the rest of my life. I stood there and watched the baby die when I had the knowledge to save him, as did other Ethiopian doctors that were with me. It was very, very hard. In 2007, an infant unit was opened at a major hospital in Addis Ababa, the capital city of Ethiopia, only the second of its kind in the whole country. The infant unit was started out with 1 room and 2 beds and broken down incubator. In June of 2009, our organization delivered the last of many donations that transformed this little place into a 7-room, 30-bed unit with the first of its kind infant intensive care unit where babies like this boy don't have to die. Although we are making a difference as we speak in a country of 18 million people, our efforts are like pouring a glass of water in the Atlantic Ocean. But we can make a big impact if we can create well-equipped, well-staffed pediatric facilities that can be referral centers that can treat such babies. To make that happen, we need money. We ask your help to save innocent lives. Our dream is to raise about $500,000 to create at least 3 to 5 pediatric centers in the city. Can you help us? Will you help us? Our other efforts involve helping the rural population of the country. We're presently working with St. Mary's Hospital in Apple Valley, California, to save thousands of lives in rural Ethiopia. We are starting out with supporting a small clinic in northern Ethiopia that provides medical care to over 67,000 people. But our efforts will need to be duplicated across the country to save lives like this lady that was carried to the clinic on a makeshift stretcher, bleeding profusely from a miscarriage. Her family was told the clinic could not help her because they didn't have the equipment needed to arrest the bleeding. Chances are this young lady bled to death after her visit to the clinic. We are also working with a division of the Humane Society of the United States, Best Friends Animal Society, and the Ethiopian government to spay, neuter, and vaccinate homeless dogs in the capital city of Addis Ababa, thus reducing the suffering of dogs and decreasing the number of rabies incidents in the country. We're also involved with supporting vegan societies in Ghana, Nigeria, Togo, and a few other countries. We will be co-hosting the first International Animal Welfare Conference in Nairobi, Kenya, with ANAW, African Network for Animal Protection, and WISPA, World Society for Protection of Animals, in September of 2010. As I mentioned, earlier in late October of 2009, we attended the Second West African Vegetarian Congress, and I would like to share some of the clips of the video with you. The Congress was held in Accra, capital city of Ghana, at the Kwame Nkrumah Memorial Park. About 75 participants gathered at the park. We marched for about an hour through the city center to the health ministry. A car with loudspeakers led the vegan walk. On the way, participants distributed leaflets explaining what veganism is. We met with a representative of the health ministry and then walked to the Minister of Agriculture and met with representatives of the Ministry of Agriculture. Both representatives conveyed their gratitude on behalf of the ministers. After the meeting, we walked back to our vegetarian restaurant. In the afternoon, we went to a large orphanage in Accra where we provided vegan food for the children and talked to the management of the institute, after which we went home to prepare for the main event the next day. The talks the next day started in the morning in front of some 250 to 300 people. 50 yards away from the speakers in the same park, around 20 stalls had been set up by producers of veggie food, owners of veggie restaurants, practitioners of traditional African herbal medicine. The stalls had a very rich and varied selection of veggie food, including gastronomic discoveries and new flavors that proved how dynamic Ghana is in seeking new taste. For 4 to 5 hours, 10 or so speakers explained the advantages of and the necessity for vegetarianism in today's world. The speakers included the former chairman of Ghana's Supreme Court, a young 81-year-old man who has been a vegetarian for 50 years. We also had Emmanuel Iyo from Nigeria, IVU Regional Coordinator of Africa. Myself and Dr. Dave Way, a Canadian who has a doctorate in biology and teaches mathematics at the University of Lomé in Togo. We also had a representative of the Hippocrates Institute located in Florida, and many, many other people. Now, my talk dealt with the negative consequences of meat and dairy consumption on health and the environment in Africa. 2009, stating the single most important cause of global warming is intensive animal agriculture. This report refutes the claim by FAIO that claims that only 18% of global warming emissions come from raising chickens, pigs, cows, and turkeys, and other animals, and that most of the rest of it is caused by products of industries, factories, automobiles, and the likes. In other words, by supporting organizations raising animals for meat production, by buying meat for consumption, every person is contributing to the worsening of global warming. For those of us who talk about how much we care for Africa, we need to realize that Africa will be hit the hardest and has the least resources to combat global warming. It's already happening. Mount Kilimanjaro's ice caps are melting. Lakes and rivers are drying up. My country, when I left more than 25 years ago, was lush and fertile. 25 years later, some parts of it looks like the Sahara Desert. Future conflicts in Africa will be between countries lacking water, not oil. A continent already burdened with so many problems will not be able to handle the consequences of global warming, nor can the animals and the diverse plant species that will disappear. The tropical forests of the Congo, the only tropical forest left in Africa, and the Amazon in Latin America are being cleared for cattle grazing so that countries and companies can sell their cattle to European nations and the United States. For every hamburger sold in the West, 6.25 square meters of forest is destroyed, aptly called the hamburgerization of the forest.